Okay. Hello, everyone. I'm Gavin from China Books Sydney and Chinese Medicine Education. Thank you, everyone, for coming and joining us this Sunday morning, or for Michelle joining us on her Saturday evening. I just wanted to do a quick little intro before handing it over to Michelle. Um, so we're very excited to have Michelle Gellis here today. She's one of the leading authorities in cosmetic and facial acupuncture and has spent many years as a clinician, but also traveling around the world and teaching on the subject. We've had her a few times already, and she's just recently published her latest book, Treating the Face, which was a long time in the making, and it looks absolutely amazing. We'll be getting stock of it in China Book Sydney very soon, I think. Yeah, full of color images, detailed explanations, and yeah, I think it'll become a sort of go-to text for years to come. And a little note, we've got Michelle coming back in to do a certification workshop in Sydney, February 7 to 9th. This will be a really hands-on workshop. So as part of the ticket price, we'll be giving you recorded lectures from her previous events. So you'll be able to review that content, which will allow us to really get hands-on in terms of like time for practice, demonstrations, corrections, all those kind of things. And then for those of you who have already studied with Michelle, there's also going to be new and updated material, including some neuromuscular protocols, which is going to be covering on day 3. Part of those neuromuscular protocols is the facial motor points, which is what Michelle will be introducing to us today. So if you're interested in that, I'll put a link to our course page in the chat box. And then just before I hand it over, throughout the talk, if you have any questions at all, please just pop it in the chat box and we'll have a little time at the end to go through questions. I think that's about it. And over to you, Michelle.
Thank you so much, Gavin, and welcome everyone. Good morning. Indeed, it is 5 o'clock at night where I am on Saturday. So I am really excited about coming back to Sydney again. This will be my third time there teaching. And as Gavin said, we are going to be covering a full day in addition to 2 days of cosmetic acupuncture. We are going to do a full day of neuromuscular facial acupuncture, which is something that I'm always asked about, and it can really be beneficial in your practice because when you do cosmetic acupuncture, a lot of times people will ask, well, can you help with my asymmetry? Can you help with this drooping? Can you help my sister-in-law who has Bell's palsy, or my mother who has trigeminal neuralgia? So really learning about how to treat a lot of these neuromuscular conditions is very beneficial in addition to the cosmetic piece. So I'm going to go ahead and share my screen. So the motor points that we're going to be talking about today are mainly with respect to cosmetic conditions, but I will touch a little bit on some neuromuscular things as well. So before publishing my book, I had been published several times in the Journal of Chinese Medicine and other publications in the United States. And in addition to teaching cosmetic acupuncture, the weekend will also include cosmetic facial cupping and gua sha. And we will also review and talk about, and I will demonstrate microneedling for those of you who are interested in incorporating that into your practice. Some of the other classes that I teach have to do with safety, ethics, all of treating the face, and I even have a self-care, facial acupuncture self-care class that I teach so that we can all be a product of our product and look good. So I actually have a copy of my book here, and it's a hardcover book. I don't know how well you can see it. It's about 500 pages, and I really quickly just marked a couple of the pages when Gavin and I were talking, but it's all color illustrations. It goes over really the unique nature of treating the face. There's a 5-element section. I have a chapter that I called The Anatomy of Expression, and I go through all the different facial expressions that we make, which muscles are used, and how they affect our different expressions, how that can affect our physical health, how our physical health shows up on our face, and different facial motor points and other points that can be used to treat them. There's a 150-page cosmetic acupuncture section and neuromuscular, just different conditions, a whole chapter just on all the neuromuscular facial conditions, and then different techniques such as facial points, motor points like we're going to talk about today, scalp acupuncture, which I also use for treating neuromuscular facial conditions, submuscular needling, which is something very unique that I teach, facial cupping and gua sha, which I mentioned, microneedling, red light therapy, and skin care from a Chinese medicine perspective, and also from a Western medicine perspective, and also self-care, as I mentioned. And the book has in it images of like how to actually needle the different things that I talk about, and it is fully indexed. So it just came out in November, and I've sold 1,000 copies already. So a lot of people are buying it, and there's just some pictures. So let's talk about motor points. Facial motor points have been used for quite a bit of time. They're not something new in Chinese medicine, but they were used differently. They're not the same as trigger points, and I'm going to talk about that in a moment. And they're not the same as like ashi points. They've actually been used by Western medicine in going back to the late 1800s. And more recently, there's been a lot of work and study in our medicine on the use of motor points. So what exactly is a motor point? I'm going to move our faces out of the way here. Good. So if a muscle is not functioning properly, it's either in spasm, it is too lax, it is too tense, then taking an acupuncture needle and putting it into these motor points is like a reset switch, and it will allow the muscle to function better. And the reason why this is so important in cosmetic acupuncture, especially, or any issues having to do with the face, is because the skin on the face is directly connected to the muscle, which is why we can move the skin on our face and voluntarily, and we can't move the skin anywhere else on our body just by willing it to happen. You can't move the skin on your arm, but you can move your cheeks and your lips and your eyebrows. So learning where the motor points are, how to needle them, and what they're used for is very beneficial. So this is taken from an old medical textbook. This is a profile of someone's face, and mapped out on it are all of the motor points. And the person who did the design for my book, I should have marked this page, he did an amazing, he went so far above and beyond. I'll never find it, but he mapped out all of these points, and because all I had were the numbers, but he actually put down exactly what muscle they're for. So I mainly work with these motor points here, the ones on the neck, and then there is a motor point for the temporalis, which is just anterior to gallbladder 8, which is great for people that have TMJ, trigeminal neuralgia, and then those gallbladder headaches. So let's talk a little bit more about what a motor point is. So a motor point is located along the motor nerve, and so not on the sensory nerve, but on the actual motor nerve. And it is the most electrically excitable part of the muscle where the motor nerve bundle is attached. And as I mentioned, motor points are not trigger points. Trigger points are more like our ashi points, places where when you press down on it, it's sore. The good news for us is that many motor points, because motor points may or may not be tender when you press on them, but many motor points, especially on the face, are acupuncture points. So it makes it easy for us to find them. So as I mentioned, the skin on the face is directly connected to the muscle and the bone. So we can move the skin on our face without having to move a bone or a tendon. We can just move the muscle, and once we move the muscle, then the skin will move. Everywhere else on the body, the muscles are connected to either a tendon or another bone. They don't go right up to the skin. And so what happens is here's a cross section. You have the muscle, which is connected directly to the skin, and then down to the bone. And when you contract the muscle, it causes these wrinkles in the skin. So you can imagine if someone's muscles are very tight, like in their forehead, they're going to get wrinkles. And so what you want to do is to relax the muscle, relax the face, and then the skin will lay nice and smooth over the bone and over the muscles. Conversely, if someone has a condition like Bell's palsy, where the muscle's not working at all and the face is drooping, by stimulating those motor points, you can help to get the muscle back into normal functioning through stimulation. And the nice thing is that this will work months or even years after the person has had the condition, whether it's a stroke or Bell's palsy or some other condition that has caused paralysis, if they have drooping of their eyelid, if they've had an injury, it can be very beneficial for. I treated patients that had been afflicted with Bell's palsy 10 years prior, and using the motor points helped. And I've used motor points. I've had um, Bell's palsy patients as young as 3 and as old as she was in her 80s, in her late 80s. So they're beneficial across the board. So motor points are all the are all innervated by the 7th cranial nerve, except for the masseter and the temporalis, which are innervated by cranial nerve 5. So when you're trying to figure out which motor point should I use, first you have to determine which muscle is affected. And so I'm going to give you some examples of that. And so the way that this comes into play with cosmetic acupuncture is by treating the muscle. And if you're working with the fascia also, this can really improve the overall appearance of the skin. The exceptions would be skin conditions like acne, scarring, or skin discoloration like rosacea, or some of the more fine lines. So the way that I work motor points into my cosmetic acupuncture treatments, for those of you who are already practicing cosmetic acupuncture and you're wondering, well, when would I work these in? Normally with my patients, if I'm doing cosmetic acupuncture, I use my regular protocol. But if I have a hard to treat area, a really stubborn condition, then I might use some of the motor points. So the basic facial acupuncture techniques are good for kind of overall lifting and sculpting of the face. But if they have really deep wrinkles and folds, things that just aren't getting any improvement with the cosmetic acupuncture, then I will incorporate in some facial motor points. So this is a face that's aging, and there's a lot of different ways that our face ages. Some of it has to do with genetics, some of it is lifestyle, some of it is the sun, bone structure, how much fat you have on your face. And so some of the things that happen are forehead lines, the temples can lose some of their bone and fat. And so they start to look more concave. You get changes underneath the eyes, and this area, the tear trough, will get lower and lower over time. Can also get wrinkling around the eyes. These are called nasolabial folds, and these become more prominent as the fat in our cheeks that used to be up here, it starts to, starts to slide down, and it puts weight here. Also, smiling can cause this, and bone loss in the cheek area, and then the muscles, as the muscles start to lose their tone and they're not holding the sides of the face up, these lines can form. You get these little marionette lines that go kind of from the corner of the mouth down, so you look like a marionette. The mid face can tend to hollow as we age because we lose fat in this area. We also lose bone in our jaw, which can cause some hollowing here, plus the depressor anguli oris, which is right here, which is attached to your platysma. It will pull down and the sides of your face will start to jowl. Wrinkling on the chin can occur, and motor points can really help because the mentalis muscle can become very tense as we get older from pushing our lips together over time, and working with these muscles can help with some of the wrinkles and the marking that can happen in the chin. So this is a face, an example of a face that's not showing many signs of aging. And then again, as we age, the signs of aging start to appear. And then if the person got no cosmetic acupuncture whatsoever, didn't have any fillers or surgeries, most people would show some, or in some cases, all of these signs of aging. So let's talk about forehead wrinkles. They're very common. They can come from, I see them a lot in my wood constitution type people, people that are always inquiring and questioning. So they come from raising the eyebrow. People that worry a lot or in fear, open your eyes, your eyebrows go up. And from a neuromuscular standpoint, someone that has Bell's palsy, they will only have the wrinkles on one side, because on the other side where they have the Bell's palsy, the muscle is completely flaccid. So there'll be an asymmetry in the wrinkles on the forehead. So this was a patient of mine. She was very young when she came to me, but she had had her eyebrows, both of them, were starting to droop as she was getting older, and it was causing her eyelids to look very heavy. And she was a pharmaceutical rep, and it was affecting her job. People were asking her if she was tired, and she had come to me for years for shoulder, elbow, wrist thing. She was always carrying this heavy bag around. And she had seen my brochure in my waiting room, and she asked, if cosmetic acupuncture could help with that. And I said, well, go ahead and get on the table. And all I did was treat just one eyebrow. I used gallbladder 14 as a motor point. I did put in a couple of other submuscular points at the same time. And but I just treated one side and left the needles in for half an hour and came back in. And I gave her a mirror, and she looked a little upset. And I said, "What's the matter?" She goes, "Well, I can't go home like this because now I'm all lopsided." So we worked on the other side, and she ended up being a patient. So the first motor point we're going to talk about that I was just mentioning is gallbladder 14. So this is the frontalis muscle. You have one on your left and you have one on your right. And the motor point for the frontalis is gallbladder 14. And the frontalis raises the eyebrows and at the same time will lift the eyelids while it's lifting the eyebrows. And so just taking a very thin needle and using an oblique insertion about less than half an inch. I mean, you go into the muscle, you don't want to go through the muscle. So it really depends on how thick their forehead skin is. But you go in and you would just stimulate the point. And I have a little video. So this was another patient, and she had come to me, trying to remember what her story was. She had had some issues, I think, with her eyelids drooping. In any event, I put the needle in. I just happened to have my camera handy because as soon as I put the needle in, um, you could see immediately the needle, once I stimulated it, it started jumping, which will happen frequently when you are actually needling the motor point, the muscle will jump. So another place where we see a lot of wrinkles and signs of aging or just expression lines. I've seen these in individuals as young as their early 30s, are these lines between the eyebrows. This is the area where people are getting Botox in order to smooth these lines out. And young girls, especially as young as 19 or 20, are getting Botox so that they don't get these wrinkles. And what they don't realize is Botox, after a while, it just stops working. So by the time they actually would need it, besides how dangerous it is to put a neurotoxin into your bloodstream, because it does get into your bloodstream, but by the time they would need it, um, it probably won't work for them anyway. So what we can do to help, besides just a local treatment to stimulate collagen in the wrinkle itself, we can use a motor point right in the corrugator. So the corrugator pulls the eyebrows together, like when you're angry, and um, you would the motor point is just lateral to bladder 2, and you insert it just at an angle towards the nose. And again, you would stimulate it. Additionally, if someone has these lines, you can use the motor point for the procerus, which the corrugator connects into the procerus, and it's like a triangle shaped muscle at the top of the nose. The procerus also causes the bunny line right on the bridge of the nose, that kind of wrinkle right here. And so by stimulating the procerus, not only do you calm the mind and relax the forehead, but it can help with that wrinkle. I had mentioned wrinkles on the chin, and people that purse their lips a lot, people that have a lot of fear, they hold a lot of fear in, or just from volume loss in the chin over time, people can get these little marks. They call them popcorn or orange peel skin on the chin. And even when you're not making this expression, people can have these marks on their chin. And um, and when people have Bell's palsy, they can lose. So this is part of a couple of muscles, which I'm going to talk about, but you can see how when you're making this face, you are pushing your chin up towards your lips. And when someone has Bell's palsy, one of the issues they can have, or any sort of facial paralysis, is drooling. They have a stroke because they can't push their lips together. So helping the depressor labii inferioris to work properly can help to get them to the point where they can push their lips together. And the point is actually the extra point, which is one soon lateral to REN 24. So it's right in line with REN 24. It's one soon lateral to it. And another point is the muscle. So here is the depressor labii inferioris, and then right next to it is the mentalis. So the other motor point that you can use for people that have these issues is the motor point for the mentalis, which is also in line with REN 24, but it's a half soon lateral to it. And this was actually a student of mine. I was teaching a class in North Carolina, and I was doing some cosmetic demonstrations on her. I was demonstrating some work on the platysma, and she mentioned that she had had Bell's palsy many years prior, and that she still had trouble pursing her lips together. She couldn't whistle. When she would brush her teeth, she couldn't really spit. And so I put in a couple of the motor points, and as soon as I put the needle in, it started moving. And you can see the twitching happening in her chin. And then I stimulated it, and the muscle really, it really jumped. And she came in the next day. So that was on the day that we were practicing acupuncture. The next day we were practicing cupping and gua sha. And she came back in and she said it was like a miracle that it had reset itself. And I heard from her later on, and she said it never went back to being the way that it had been before I treated her. So this is a picture of lip wrinkles. And when you're young, you can make this face. And it's funny, I was just watching an episode of some show. Um, and the young character in the show, she makes this face all the time. And me doing what I do for a living, I'm looking at her and I'm thinking, oh, if you keep making that face, you are going to have the worst lip wrinkles. But in any event, this is what they look like. And they are formed from uh, utilization of the orbicularis oris muscle. So it's a sphincter muscle, and it pushes your lips together. So when you're young, you make the face, and then the skin goes back to the way it was. When you're older, you make this face either from uh, just whistling, kissing, um, drinking out of a straw, which is one of the reasons. So there's a few reasons why women tend to have more lip wrinkles than men. One of them is women tend to drink out of a straw more frequently, more often than men do. And since men shave all the time, they're constantly exfoliating this area. And also, this area of the face is very, there's a lot of estrogen here. And the hormones in this area have a lot to do with breastfeeding and receptors. So there's a lot of receptors in this area for estrogen. And as we get older, we lose the estrogen in this area, especially women who have a lot of estrogen, and that's why their lips are all plump. And the other is, as we get older, our skin tends to thin, but that happens to everyone. And our teeth also move towards center as we get older. So the mouth itself becomes smaller. So there's a lot of different reasons why this can happen. So for the orbicularis oris, there are two motor points, and one of them is Li19, and so here's the orbicularis oris in yellow, and all of these images that you're seeing today were taken right from my book. So if you want to know, like, what do the pictures look like? I was very fortunate to find a graphic artist who was able to work with me during the past few years to get all this done. I did self-publish the book, so it was an adventure. My next book will be Why You Should Never Write a Book. That will be my next book. So some people are laughing. Some people are like, I don't know you. Is this funny? Is that supposed to be funny? So Li19 is one of the motor points, and the other motor point is halfway between stomach 4 and Ren 24. And so it's right here. So you would needle both of these points on both sides. Just to keep the picture clean, I only labeled one side, but you would needle these points on both sides, and you would go through the superficial muscles down into the orbicularis oris. So some other uses for facial motor points can be to help with the nasolabial folds, like I spoke about, and marionette lines. The muscle right here. So this is the modiolus right here. And it basically sits right underneath stomach 4. It's a little lateral to stomach 4. And the motor point is right over the modiolus. And as you can see, all of these muscles attach to the modiolus. And so by just stimulating this one motor point, you can help the depressor anguli oris, the rosaris, there's levator muscles. All of these muscles are attached. And so this is an important point when you're thinking about cosmetic things, people that have asymmetry, where part of their face is drooping down. So also there were motor points around the orbicularis oculi, much like around the orbicularis oris. And there are even motor points on the neck to help with the platysma and the SCM. And these can really come in handy dealing with the necklace lines, or we call it tech neck, from having your head down, or just aging. When the skin on the neck ages, it can develop these folds. And these are right here are called platysma bands. The platysma will separate as we get older. And one of the techniques that I teach in my cosmetic class is a submuscular needling of the anterior digastric right here to help with this platysma banding. So in addition to Bell's palsy, I talked about Bell's palsy a lot. Facial motor points are very beneficial for Ramsay-Hunt syndrome, synkinesis, stroke, wonderful for TMJ. I just had a student in my last class I taught here in Florida, and her jaw, you just put your hand on the side of her face. You could feel her masseter and how tight it was. And we worked a lot with some submuscular needling and motor point, did some gua sha, also worked with the motor point that I mentioned that's just anterior to gallbladder 8. So every muscle in the face, every superficial muscle and some of the deeper muscles on the face have a motor point. We just touched on a few of them. But in class, we go through all of them. Um, Also, for trigeminal neuralgia, a lot of times a person's face is too sensitive to needle. But the reason why many people get trigeminal neuralgia is a lot of tension or entrapment of the nerves, either coming out right around SI19 or underneath the temporalis. And by using the motor point on the temporalis, you can help with that. Ptosis, motor points are great for helping with drooping eyelids, hemifacial spasm, and myasthenia gravis. So to kind of wrap up, again, my class will be February 7th through 9th in Sydney. And I think Gavin said the last day, it's actually going to be the first day of class, will be neuromuscular facial acupuncture live lecture and practice. And then students receive over 20 hours of recorded lectures on cosmetic acupuncture, Chinese face reading, microneedling, facial cupping, gua sha. And then we spend 2 full days in class practicing all of these different techniques. And we're going to go over scalp acupuncture, motor points, submuscular needling, basic and advanced techniques. It's going to be a really comprehensive certification weekend, lots of hands-on time. I will have at least one assistant, and depending on how many students we have, I may have 2 assistants in class. So do I have any other? Oh, if you want to follow me on social media, I'm on Facebook under my name. And I also have a Facebook group with over 10,000 acupuncturists in it. It's called Facial Acupuncture. And I'm on Instagram under my name. And I'm also on TikTok. You got to keep up with the times, right? And my website, if you want to get really into the nitty gritty about my classes. And also there's a lot of demo videos there, and is facialacupunctureclasses.com. And there's a link there to sign up for my Sydney class. So I've left a couple of minutes for questions.
Right.
Were there any questions in the chat
We
box?
didn't have any questions come through. If anyone does
Okay.
have any questions, you can feel free to either unmute yourself and ask, or pop it in the chat box now, or pop up your hand. Otherwise, we might wrap it up and let everyone get off to their
I've got
Sunday.
a question.
Yep.
Hi.
Hi,
Oh,
Michelle.
hi.
How are you?
I'm good. How are you?
Well, thank you. I love learning about the motor points, and I definitely don't feel confident with them. So will you be teaching us more about those in Sydney in Feb?
Yes, absolutely. We're going to be talking about more specifics with each muscle, how to needle them. There'll be time to practice them, and that'll all be on the neuromuscular day.
Brilliant.
So, yeah.
Thank you. And we can get the book now, can't we?
Yes, Gavin would have more information
Yeah, I believe it's we're
about.
just getting stock of it now.
Great.
Okay, we've just had another question come through from Andrea. What's the difference between the microneedling pen and a derma roller?
Good question. So, a microneedling pen is an electric device that has, I don't have one handy, and I'm not going to take time to pull up a picture, but it looks like a pen and it has tiny little needles. And when you turn it on, the needles, it has 16 needles in it, and the needles, you move it along the skin and the needles penetrate just the very outer layer of the skin. There shouldn't be any bleeding or bruising or anything, but just enough to stimulate collagen production. Whereas, and you can only do it once a month. So it's a more deeper level treatment, and it doesn't take very long. Microneedling, when you do microneedling, it takes about 20 minutes. And I do put some acupuncture body points in when I do it. And typically people come like 4 to 6 times, and over a period of months. And it's really great for those lip wrinkles, the crow's feet, acne scars. You can use it on the body for stretch marks. It's great for the back of the hands, for aging hands, chest, neck. A derma roller is something that you just roll gently on the skin, and depending on how hard you're pressing. So it also has needles, usually around 500 little needles on a little roller, and you just manually roll it. And both of them will help the absorption of skincare products and stimulate collagen. But the derma rollers are meant to be used more often, more gently, and really to help with skin turnover, product absorption, and stimulate collagen. Both of them can also be used for stimulating the hair follicles for hair loss. And yeah.
Right. We also have Angie wanted to ask a question. Did you want to chime in, Angie?
Thank you. Seems a bit complicated to type in. Michelle, I've got a patient she had arteries wrapped around the trigeminal neuralgia, and it was strangling it, the trigeminal nerve, and it was strangling it.
Yeah.
So they've done surgery. Obviously, the whole face is now paralyzed. She has no sensation, lack of lip movement on one side, and all of those I'm pretty sure I can hit with the motor points, but she's now deaf in that one ear. Any ideas, tips?
So I've had a few patients over the years who have had that surgery. And usually they resort to that when the pain from the trigeminal neuralgia. And if you've never treated a patient, or you haven't met anyone who has trigeminal neuralgia, it can be debilitating. It's just this waves of pain that shoot through the face. And for some people, it's just constant. So by the time they get to that surgery, they're like, I don't care, just make it stop. Because they're taking Neurontin or whatever, and it's not helping. So to answer your question, the way I approach any sort of neuromuscular facial condition is I will start with like the most innocuous treatment, just doing a motor point, seeing if that helps. If that doesn't help, then I start to layer in. So I do submuscular needling. And in her case, I would probably be working around the temporalis to help with it, because everything is so connected in this whole area. Certainly, of course, it goes without saying, you have to look, you have to do your TCM diagnosis and treatment to deal with any deficiencies that
Sure.
may be contributing to this, to what's going on. But also scalp acupuncture is amazing. So, between now and if you're going to be taking my class between now and then,
Fingers crossed.
um,
Fingers crossed. I have to travel from Christchurch in New Zealand, so bit of a
oh,
challenge, but I'm trying.
oh, come. I know I was
Still
just
gonna do my best.
communicating. Okay. I would love to come to New Zealand, but I feel like I'd have 6 people in the class. So,
Just because
um,
we're a small country, that's all.
I've been, and I am ready to move, let me tell you. Anyway, I digress.
I've got a spare room.
I promised myself I wouldn't talk politics. I'm like, I only bought a one-way ticket this time. So, so anyway, so working around the temporalis and really just kind of needling around the outside of the temporalis, using the motor point for the temporalis, and then doing some scalp acupuncture to affect the sensory area. And I would just do both sides. So the sensory area for the face,
Yeah.
the scalp acupuncture can help.
And are you talking about a specific scalp acupuncture or just using the standard acupuncture points we've learned?
The standard, well,
Right.
no, scalp acupuncture on
Yeah.
the model of scalp acupuncture. Yeah.
Okay. Thank you.
You're welcome. Oh, and a little facial cupping if she can tolerate it, where any entrapment might have been going on around the ear, especially if you can get, in back of the ear. I find that a lot of times gallbladder 12 and 20, just needling those, doing gua sha on those, cupping on those, getting back there can really help.
Thank you.
You're welcome.
We just had another question from Andrea. What product do you use before doing microneedling?
So I have a company that has a microneedle pen and all the accompanying products. So the product that I use is hyaluronic acid, but it also has vitamin C and collagen in it. So the vitamin C helps with the brightening, and the collagen, because you're microneedling it into the skin, it will help. Normally, if you just put collagen on your skin, it's just sitting on the outside layer. But if you microneedle it in, it can really help. The hyaluronic acid gives it the slip, right, when you're moving the pen. And I believe China Books has a supply of the serum if you wanted to get it from them. So
Yeah, we do have,
you can
I can't remember exactly, but we do have a range of some of your products in the shop. So yeah, if anyone's interested, you can get in touch with us, China Book Sydney, and we can help you out with that. Actually, I had a quick little question I thought of with the motor points. I was curious, are you just doing manual stimulation or do you ever use electrostimulation or?
So I'm not a big fan of using electricity on the face, mainly because of 20 plus years of treating patients with facial conditions and knowing how sensitive the nerves on the face can be. The facial nerves are very unique in how close they are together, how close they are to the surface of the skin, and the face is the only part of our body where we tend to get like these heat conditions, maybe like the face, neck, and chest, but really the face gets the twitches and the a lot of the different concerns that you don't see elsewhere in the body. So I stay away from electricity on the face. I feel like it can cause more problems than it can help. I just gently stimulate them.
Yeah, good to know. Thank you.
I've got one more question, or yeah.
Sure.
Hi. So with patients who have had injectables like Botox and fillers, when they come to you and they want to stop that and they begin the course of cosmetic acupuncture treatment and microneedling, how do you find the results and their satisfaction with those?
Well, that can be it's a complicated question because it depends on what they've been doing, how long they've been doing it for. Now, are you saying they want to stop doing that and do the cosmetic instead?
Both.
So yeah, no, they can. I mean, I've had patients who just had Botox in their forehead, and I worked on the lower part of their face. Or I've had patients who've had Botox and they hate it and they want it out because they can't express, right? They can't make any facial expressions. And they find that they're angry all the time because they can't emote.
Frustrating.
So usually if it's, so there's a waiting period after they've had the Botox before I'll start putting needles in their face because I don't want to get blamed for something someone else did. But if they say, you know, I want a more natural look, and we just start doing the cosmetic acupuncture, normally their face is not going to go back to the way it was. Now, with fillers, obviously we can't put fat in somebody's face, and that's what a lot of these fillers are. But we can help but especially with the cupping and the gua sha, to keep good blood flow in the face, to sculpt the face, to reposition things so that they kind of stay where they belong. And I find that people they start to look more like themselves. And, you know, just even when you're doing gua sha on someone's face, you're stimulating the bone. You're working with those fascial adhesions that hold things down and give people kind of a distorted look. And people, you know, are getting a lot of these things done. And in my opinion, they think they look better, but they just look like everyone else their age that's having it done.
Absolutely.
It's not always a good look, but I will absolutely work with people that have fillers in their face and, you know, whatever, as long as we're very clear on what we can and can't do, when we can and can't do it. And I need to know what's been done, and they have to have some sort of a note or something from their doctor, specifically what was put in their face.
Will you give them cosmetic if they're getting Botox, will you give them cosmetic acupuncture at the end of their cycle, say like 3 months after the Botox before they're about to have one? Yeah.
Sure. Yeah. And sometimes people will just say, well, I just don't want to get it as often. So when it starts to wear off and they can tell, they can move their muscle, they'll come to me and they can go another month or longer before they get it again.
Right. So to extend the use, yes.
But I've had patients they came to me from the time they were in their 40s up until when they were in their early 60s. And they would go to their high school reunions or their family events, and everyone would ask them, what did you do? Are you having, did you get? And they're like, no, acupuncture. So,
Amazing.
yeah,
So good.
yeah. It keeps me
Yeah, your skin looks incredible.
whatever.
Looks so good.
So, yeah.
Yeah, I think it's
Anyway,
really important now because there is a trend going on with lots of women getting
oh God.
all this, and it's good for
Well,
them to have options.
yeah. Yeah. Between the eyelashes and the lips. I don't know what's going on down there, but over here is people are just starting to look a little strange. And I think they get a little facial dysmorphia too. I don't think they realize um, you know. So I try to wean people off a lot of that stuff as much as I can. So
Brilliant. Thank you.
you're welcome. Okay. Well,
I think
if
that's everything.
anyone, if anyone has any other questions, usually the best way to contact me with questions, even if they're patient questions, is to go into that Facebook group. I know a lot of people don't like Facebook, but if the only reason you have an account is just to go into my group, come on in, ask your question. I get on there at least once a day and answer any questions that people have. So, and my book goes into is a lot more in depth about everything because there was time, 10 years, 10 years of, putting these 500 pages together. So, but the weekend class is a certificate course. The way I have it set up is even if you have zero knowledge of cosmetic or facial acupuncture, by the end of those 3 days, you will feel comfortable. You'll probably want to practice a little, but you will know everything you really need to know about doing cosmetic acupuncture. You don't need to take more classes and more classes if you don't want to. So Ilana's actually going to be my assistant. I didn't know you were popping on. I'm just thrilled.
Yes, I couldn't miss out.
Okay. So
Yes,
any other questions?
yeah, nothing else has come through.
Okay.
Thank you. Yeah, thank you
Great.
so much
Well,
for your
thank
time,
you
Michelle.
all for spending your Sunday morning. What day is it? Sunday morning with me.
Yeah, and your Saturday
And
evening. Thank you.
yes. Yep. And we will see you, hopefully we'll see you live and in person in Sydney.